Hello, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk about today is a term that gets thrown around a lot, and I think I think people get diagnosed with this condition and they understand that they have it, but they don't really understand what it truly means. And we find that a lot when we're treating people with this condition, that we have to provide a fair amount of education about what is really going on and why some of the movements and activities we recommend or prescribe are actually beneficial, even though initially they may cause some discomfort. So that condition is spinal stenosis. Um, I'm not a physician, but I am trained in the pathology and some of the treatments. So the way that I feel about spinal stenosis is that is a very general explanation of what's going on. And that general explanation is it's some sort of narrowing or compression of the spinal cord. Um, so I would put spinal stenosis as an all-encompassing term for a couple of different conditions. Um, but essentially, if you understand the anatomy, you've got your spine, which is made up of the bones, the vertebra. Hopefully you can see my cursor on the screen. I've borrowed all these pictures from the Mayo Clinic. They have some really good illustrations here that help describe what's going on. But as you can see in this picture, there's in white, in these big structures are the actual vertebra, the bones. And between each vertebra is a nerve root that's coming out. These are the nerves that supply your muscles, your vital organs, your skin, other sensory organs. And from the top of your head all the way down to your lower back area, you've got a central canal, which is, this is a top view. So you've got a central canal, which in the spinal cord, which is nerve system tissue, it's soft, travels all the way down through the spine and comes out at different levels, like this top picture, and supplies your muscles, your vital organs, and everything else. But that canal going down from the brain all the way down has to have a good open pathway to work efficiently. A very similar analogy is if you say you've got a house and your house has a central junction box where things are coming, and then you have different supplies to the different electrical parts of your house. And if that's getting either bent or compressed or short-circuited, you're not going to have a good flow of electricity. So that's a very general analogy, but essentially your body has to have a good, open, natural pathway for the spinal cord to travel down, and then at the level it's supposed to go out, a good open pathway for the root to come out and supply what it needs to, or in reverse, to retake information back to the brain. So hopefully you can see my cursor here in the middle of the screen. This, usually the canals are called foramen. This big opening right here is very, very important. And this big opening, this is a top view where your spinal cord travels down, is also very important. So I want you to take a look at this picture and just have it mentally in your head. These are nice, big, round openings that don't have any encroachments. But as you can see, the spine, each vertebra interacts and articulates with another vertebra, and you've got a disc, this flat structure in between. And if any of these structures are compromised, they can put pressure on the nerves. This is why I'm saying stenosis is a very general term, because it may be one or multiple origins of the actual stenosis. It may be one of these facet joints here between each vertebra has arthritis, or it may be that one of these discs here is a little bit bulged or herniated, putting a lot of focal pressure on here. Or it may be that down here around the central canal, the cartilage is worn away and arthritis is allowing for a buildup of bone and pushing on the central canal. So you have to keep this in mind. Essentially, you just want a good open pathway for the nerve tissue to travel. So again, I've borrowed these pictures from the Mayo Clinic because they have some really good illustrations and some good additional resources as far as a well-written text explanation of what spinal stenosis is, some more pictures, some general treatment guidelines as far as home care treatment. They also have some information about where and when you would get diagnosed with this, and some of the initial signs. So I encourage you to, if you're able to get on the internet, look at the Mayo Clinic and search spinal stenosis. They have a lot of good resources just for general information. So this is a good picture also from the Mayo Clinic, illustrating what I feel is the typical, when you think spinal stenosis or you're educated on spinal stenosis, this is what comes to mind. It's because of some bony structural change to the vertebra, or whether the facets here have become very arthritic. They've encroached on the central spinal cord, and also have, through bony outgrowths, have encroached on the nerve root, really pushing on this nervous tissue, allowing it to be short-circuited and not have a good flow of the information that travels. So let's pause for a minute and talk about where spinal stenosis occurs. It can occur in any part of the back. However, more commonly, you see it either in the neck, which has a certain typical presentation of symptoms, or you see it in the low back. Just because of the structure of the back, you either see it in the neck or you see it in the low back regions. So it doesn't always have to be pain. It can start very gradually, and maybe you have a little numbness in your hands, or maybe you have a little numbness in your feet that improves when you do certain positioning or movements. Or you can have pain in your hips, pain in your groin, pain in your legs, or pain in your buttocks. It usually starts very, very slow and very inconsistent, and then it will, as the condition, sorry about the sneeze, as the condition progresses, these symptoms will become more prevalent. I'm sorry. And it can usually, when you have true spinal stenosis, it can present worse when you're standing up, and when you're sitting, or when you're flexed or a little bit bent. It usually, if it's true spinal stenosis, it may improve with some of those repositioning. So the reasoning for that is when you're standing up and you're extended, you're putting a little bit more pressure on these local nerve roots and some of this tissue right here along the sides, because of the way your anatomy, normally you've got a curve in your spine, and if you're really extended, the anatomy, your joints, these facet joints, are going to articulate and extend your back, your low back a little bit, putting a little more focal pressure right here. But that's usually relieved with sitting, or with certain positions that in physical therapy we usually prescribe. So you may also, in very severe cases of spinal stenosis, you can actually have some bowel and bladder problems that begin to present, because the information from your brain going down through your spinal cord has to get to your intestines and your bladder and all those associated structures. And if it doesn't have a good flow of information, you can have just short-circuited spurts of information, and leading to difficulty with bowel and bladder control. So let's continue talking about stenosis. So this is what I feel is the true, when you think about stenosis, let's go back to the main image. See, this is a good, healthy, open space for the spinal cord to travel through. And these nerve canals have nice big openings that aren't encroached by bone. So this picture, as you can see, the bone has built up. It's no longer a nice clean canal. And this central canal is being pushed on by these bony outgrowths. Now you might ask, well, why does this happen? It can happen because of an injury, whether it's a sports injury, a work injury, a major fall, that can lead to some of these bony outgrowths. It can happen just over time through a lifetime of use of your muscles. If you're overweight, you're putting excess strain on your anatomy. Something to know about these structures are between each of these joints, between each vertebra is a little bit of cartilage, and that's a protective layer that also allows for good fluid movement. But through injury over time and wear, this cartilage wears away, leaving exposed lower bone. And bone does something funny. Bone responds to stress, and it lays down mineral deposits in areas of stress because that's a natural stimuli for the bone, which can lead to, over time and through overwork and overuse, can lead to building up unnatural deposits. Bone spurs can occur, or this just extra layering of bone, which pushes down on the structure. If it usually reaches this point where it's layered so heavily like this, typically there's limited things you can do, and maybe surgery is an option just to clean out and remove some of this excess bony growth. But there are some things you can do, like flexibility exercises, building up the strength and support muscles of the back, in certain positions that can help. So let's continue on. This is a picture that shows a very severe case of, and sorry it's so blurry, of the narrowing of the cord. This is essentially the same as this, where the bone has just overwhelmingly grown up, or whether it may have been an injury that caused a shift in these vertebra, which then really compressed on the cord. This person would probably have some major back pain and some bowel and bladder problems if it reached this point. So when I talked earlier, I mentioned that stenosis was a very general encompassing term for a number of origins for encroachment on the spinal cord. And though we don't typically think about the discs causing true stenosis, meaning the narrowing of the canal and the bony outgrowth, if you have a disc, whether it's a bulging disc or a herniated disc, depending on where it's at, it can put pressure and narrow the canal on these, or the opening of the nerve root coming out here. So that would be a more serious case. But so as you can see, this disc has bulged beyond its annular limits here. This outer part is called the annulus, and this inner part is called the nucleus. So that's why it's annular limits. It is bulged and encroached in on the nerve root space, and here it's encroached on the central canal. So this would be another picture of a very serious, and I'm sorry these pictures are so blurry, of a very serious bulging or compression of the cord. Hopefully you can appreciate here that this is the central canal of the cord, and these are the nerve roots coming out. And this is a normal annulus, which is the outer ring, and the normal nucleus, which is the inner area. And in this, the annulus has become frayed and has become weak, so it's encroaching on the spinal cord. And this picture also has a buildup of arthritis on these facet joints. So on the picture on the left, it has normal facet joints that have good, healthy cartilage. But over on the right picture, the cartilage has eaten away, and there's a buildup of bone, which is then pushing directly on the central canal and right on the sides on the nerve roots. So this would be a very severe case. So now that you have an idea of what is stenosis, and you have an idea of what can cause it, let's talk about some presenting symptoms. In the neck, you might have some initial numbness, and it doesn't have to be numbness locally. It can be numbness in your fingers. It can be numbness in your fingers or in a different place like your elbow or something. The word is distal, farther away from the origin. It might just present as that, as some intermittent and periodic numbness that over time becomes more consistent and becomes more of a problem. You don't even have to have pain. It can lead to some weakness depending on which area of the nerve is encroached upon. But some people don't even know they have it, and they just have an increasing weakness. Some people don't have pain at all, and they just have this overwhelming weakness to their legs or their arms that begins to present and begins to get worse. If you have stenosis in the neck, you might also notice some functional changes, like when you're buttoning your shirt. I don't have a shirt that buttons, but maybe it's harder to get that button in because your hands are clumsy and you're fumbling with your fingers and you just can't seem to coordinate the movements. So sometimes that's a presenting early symptom. You can also have, if you don't have any pain, you can also have loss of balance. You might actually be strong, however, the sensory organs in your muscles and your tendons can't send a good enough signal or get a response from the brain as well. So you may be losing your balance without any pain at all because these nerves are getting encroached upon farther down here in the spine, in the lower area. So how is it diagnosed? Well, if you start having some of these presenting symptoms like increasing numbness or intermittent numbness, increasing weakness or clumsiness with your hands or loss of balance more frequently, you should probably consult your doctor, your primary physician, and let them know of these things that are occurring. An X-ray is usually sort of the first line of defense. It's a quick, easy, it's not a first line of defense, but an X-ray can show some of these structural changes like these bone spurs or these layered deposits. And that would be a real quick, easy sign. Hey, you've got these deposits. They're pushing on your nerves. The space here is not as open as it used to be. So then a physician may prescribe a CT scan. A CT scan allows for a good layered, so it's in different layers, a good layered picture of the levels to be able to show you exactly where and the encroachment is, and it can define the bone a little bit better and show, hey, this is exactly where you're at as far as your stenosis problem. But if they want the true, and they can use a certain dye as well to increase the contrast of that picture. But an MRI would really show, okay, this is the soft tissue here that's getting pushed upon. These are your bones. This is where the interaction is occurring that's presenting for your symptoms. So that would be the most definite imaging that would be done, but it's depending on what your doctor feels is medically necessary. So as far as general treatment guidelines for stenosis, certain stretching of the hamstrings, stretching of any musculature that attaches to the low back and the hips and the pelvis. So sometimes people have a muscular tension issue in their hips or their low back, and a lot of stretching or mobility exercises can help to, one, reduce the pull of these muscles on the back, but also improve the strength and the stability of the back to maintain the structure better. Some other things that you could do are walking or some sort of aerobic activity, monitoring your diet and weight loss, so you're not putting as much compressive force through the spine, leading to some of these buildup deposits. General flexibility exercises. Presbyterian Village is good because there are lots of classes available, that whether it's chair yoga or some sort of stretch and flex. And the nice thing is, because all of these are recorded on video now, you can do them in your own home. And then just being conscious. Sometimes if it, just check with your doctor first if it's, you don't want to have something that's contraindicated, but sometimes moist heat or like just a heating pad to the area helps relieve some muscular tension and has sort of a calming effect on the nervous system. But again, if you've got an open wound or a recent back surgery or some other contraindication, you don't want to do any kind of heat to the area. Okay, that's it. I just wanted to give a general discussion of what is spinal stenosis. I feel in my practice, it's a term that's thrown around a lot that people don't truly understand. I have a lot of people that come and say, oh, I have spinal stenosis, but they don't know what that means or why some of the things we do that are beneficial. So I just wanted to give a brief overview and some general information. And again, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.